Starting tomorrow, the Fishers Health Department is giving students and staff at Fishers schools some priority testing for COVID-19. And these appointments are for PCR tests. They're for K through 12 students and staff in Fishers-based schools, and testing will be given at the drive-through location on Municipal Drive. Now, you do need to register online. We have a link for you tonight on WTHR.com. Meanwhile, some students in Warren Township schools will stay home and remain virtual all week. That district announcing today that grades 5 through 12 will stay with virtual learning through Friday. Now, this does not affect elementary schools in grades 4 or younger. The e-learning days this week for older students are because of a, quote, increase in staffing needs, according to Warren Township's superintendent. The Omicron variant has pushed hospitalizations all across the country close to the record set almost a year ago. Adding to the alarm, the soaring number of children in the hospital with COVID, especially kids under 5 who are too young to be vaccinated. Polo Sandoval shows us how this is now putting a strain on hospitals and schools.
With COVID hospitalizations at record highs in New York, state officials are ordering dozens of healthcare facilities to put non-essential and non-urgent surgical procedures on hold for 2 weeks. The 40 facilities, mainly in central and northern New York, are experiencing at least 90% bed occupancy. That's according to authorities. New York State, just the latest, racing to help hospitals and healthcare networks with shortages of staff and supplies amid the Omicron surge. At the University of Kansas Health System, similar concerns about their facilities approaching a breaking point.
You go from normal operations to contingency, and contingency planning means I'm going to have to put patients in unusual situations. I have to cancel surgeries. But at some point you say, we're too overwhelmed to do any of our normal daily work. We can't even meet all of our patients' demands, and at that point we have to turn on a switch that says we got to triage to the people we can help the most. And that means we have to let some people die who we might have been able to help.
The U.S. is seeing a record number of hospitalizations for children under 5 years old, and new admissions for children under 18 are averaging nearly 800 a day. The figures are fueling the debate about how the nation's school children should continue their spring semester. In Georgia, officials say public school teachers and staff are allowed to return to work even after testing positive or being exposed to COVID-19, as long as they don't have symptoms and mask up, though each school district can make its own isolation guidelines.
I believe that anything that we do that is not putting the priority on keeping students and educators and their families safe is a mistake. We should be using every tool we have in our toolbox to mitigate the spread of COVID-19 in our classrooms.
The Biden administration says it plans to make up to 500 million tests available to Americans for free this month. One emergency physician in Houston remains skeptical that's going to be enough.
We need them now, and 500 million honestly won't be enough. Every American should have at least 2 to 3 tests per week to be testing, and 500 million is not even going to get us near there.
With demand for COVID testing still high, an additional problem is emerging: fraudulent testing kits, according to federal authorities. Experts warning that using fake testing products won't just be a waste of your money. It could increase the risk of unknowingly spreading the virus and delaying treatment for it. The Federal Trade Commission recommending you only purchase tests authorized by the FDA, as listed on that agency's website.